This podcast is brought to you by Podcast Nation.
Welcome to Nirvana Sisters Podcast, where we take the intimidation out of well-being and beauty to help you achieve your highest state, your nirvana. We are sisters-in-law and your hosts. I'm Amy Sherman.
And I'm Katie Chandler. So let's get into some real conversation. Welcome to the show, Nirvana Sisters family. Today, we are sitting down with Dr. Elizabeth Poyner. Dr. Poyner is a gynecological oncologist and advanced pelvic surgeon with a deep understanding of women's health. Her expertise is in the management of complex women's health issues. She is the founder of Poyner Health in New York, established in 2006. She focuses on the management of midlife women's health concerns and aging strategies, hormonal and that's a tough one. Endocrinological health concerns, diagnostic and prevention of illness strategies for women, complex pelvic surgery, including surgical oncology and deep excision of endometriosis. Through her extensive surgical and medical background, she's able to care for women in a holistic fashion and uniquely employs both medical and surgical approaches for women's health. Most recently, she has left surgery to focus on midlife women's health, which I think is going to be our main focus today. So welcome to the show, Dr. Poyner. Thanks so much for being with us today.
Thank you so much for having me and allowing me to speak about my favorite topic, midlife women's health.
Oh, great. All right. It's one of our favorite topics too. I actually found Dr. Poyner from reading an article that you wrote a while ago. It was like maybe a year ago about adrenal fatigue and adrenal insufficiency. And I have Addison's disease, so you have such a comprehensive understanding of the adrenals. So I was just really thoroughly impressed by it, because even like the best endocrinologists, sometimes I feel like they don't totally get it. It's a complex one. So I'm excited to talk to you for many reasons. But before we do that, why don't we take a step back and start off with our Nirvana of the week? Amy, you want to kick it off?
I can kick it off. So I would say my nirvana this week was just the kids going back to school and getting back in a routine. So Dr. Poyner, my oldest son, is going into his senior year, and my youngest is going into his freshman year in high school. So it was like the first day of school for my senior and the first day of high school for my younger. So it was cute and just like kind of nice to get back in the swing of things. And the weather's been amazing. So it's just kind of like getting to that fall season. So I'm feeling it. What about you, Katie?
Yeah, that same. Our girls went back last week. It's such a fun time of year. It's been an interesting week, but I would say my nirvana this week has probably been the weather every day. And I live in Connecticut, Dr. Poyner, but I also commute to New York City for work, and which is where you are, right? And every day this week has been absolutely stunning. It's been such a gorgeous, like 70s, not a cloud in the sky, beautiful, falls right on around the corner. So I think that's been mine. What about you, Dr. Poyner?
I've had a period of gratefulness this week, actually. It's been kind of interesting, I think, with the shift in the weather, and it's been crystal clear, like very clear skies and everything just very crystal clear. And my son just started law school, and kind of everybody's kind of tucked away in our family right now and moving forward. So I think just a period like earlier this week and this week has been just a period of like just gratefulness and happy just to be here and working, and just happy to be healthy and alive right now.
Amen.
It is incredible, like how much better, at least I know I do, and I'm sure most people do, when the weather is like clear and crisp and sunny, like how much your mood changes. Because I feel like the weeks before that, it was like hot and humid and nasty, and I was just like stressed. And it's just pretty amazing how that shift, like everyone's kind of feeling it this week. So love that.
Well, why don't we kick it off? Something that would be helpful for us to understand, as your specialty has mostly been being a gynecological oncologist, but you have shifted into focusing on this women's midlife health, hormonal health. Help us understand a little bit how those two intersect. I mean, I have a general idea, but I think for our listener, it would be great.
Yeah, I think so I have like complete allopathic training, right? From medical school all the way to highly specialized surgery. And when I first started doing, and I was specializing in ovarian cancer surgery, actually. So it wasn't even just surgery, it was cancer surgery. And then it was even ovarian cancer surgery. So you couldn't get any kind of more specialized training or practice of what I was doing. And when I first started in GYN oncology, people would come to me and they would say, I had a lot of stress before I had this cancer. And they say, Doc, do you think the stress had anything to do with it? And I say, no, because we didn't have any training in that, right? Like stress wasn't really stress, nutrition wasn't really even spoken about in medical school and kind of still isn't very much, right? And then kind of midway through my tenure and training, I was like, I'm hearing this story over and over that stress is, people are having these great periods of stress before cancer. And then like kind of at the end of my tenure, and I was kind of like, yeah, maybe, it has something to do with it. And then like kind of towards the end of my tenure at a major cancer center, still I was hearing the same story over and over again. And then people would say, that stress have anything to do with that cancer? I said, yeah, probably so. So my viewpoint has shifted. It had gone a complete like 180 to like, no, it doesn't have anything to do with what you're experiencing right now to, yeah, it probably does. And we now know we have animal studies and we have human studies that show that when you're under big periods of stress, it actually changes your immune system. And cancers are under immunosurveillance. So there's a link between kind of lifestyle and our outside environment, actually, and what goes on in our body and how we process it. And women's health is like the really great intersection of that. So it's somewhere between naturopathic medicine or lifestyle type, more lifestyle type medicine, nutrition, exercise, stress management, that type of thing, and then strict allopathic medicine. And that women's health falls right in the middle there because we go through so many hormonal changes throughout our life from the very beginning, where, when we go through puberty all the way through menopause. And these put large stressors on our body, right? So we have external stressors from the external world and internal stressors. So it's a great opportunity to begin to combine the two approaches to medicine and pull from both of them to actually help women lead healthier lives and get their best health possible. I always say, live your best health possible. We always start from different foundations, right? Some of us have, issues that we're dealing with, whether they're autoimmune issues or cancer, but we can all strive to achieve our best health possible. And that's that segue in between allopathic medicine and naturopathic medicine. And women's health sits right in the middle of that. That's my journey.
Well, it segues me directly into my next question, stress being such a huge factor when obviously women have so much immense stress in their lives, and then in midlife hormones change and it just adds another layer. But what is the number one hormone that helps us manage our stress? And as you know, it's cortisol. So let's dive into a little bit about adrenal fatigue. For the last, I don't know, maybe 5, 6, 7, 8 years, I felt like that was a buzzword. Adrenal fatigue. There was a lot of talk about it. And I believe in it. I think there are some naysayers, but I do believe in it. It is entirely different from adrenal insufficiency. But what are your thoughts? What's your stance on it, on adrenal fatigue? Because stress is the number one factor for it.
Right. So I actually had so when I went into private practice and I left kind of an academic position and still had academic appointments, but was left my big academic position, I called the person who wrote one of the big books on adrenal fatigue. And I was like, what is this? This sounds like silly to me, but I wanted to learn about it. And I had a little bit of time because I wasn't seeing so many patients at the time. And so I spoke to him, he educated me. I was like, well, there's something to this, right? But I think the terminology, I think the term adrenal fatigue is a misnomer, right? Because if you talk to a straight allopathic physician and endocrinologist, they're like, there's nothing to adrenal fatigue. It's non-existent. But if you put it and you spin it in its HPA axis dysregulation, so hypothalamic pituitary adrenal axis dysregulation, oh yeah, there's allopathic articles written about that, right? So adrenal fatigue really is probably, I think, and it's just an opinion, more HPA axis dysregulation. And then if we're just talking two different languages. We're speaking two different languages. We're looking at the same thing, right? But we're talking two different languages. So I think adrenal fatigue, it's a misnomer. I think if we refer to it in more allopathic terms, HPA dysregulation, or give it a different name in the naturopathic world, right? Then there'll be more crosstalk and conversation, because there's lots of talk about HPA axis dysregulation. So what that means, so adrenal insufficiency is a primary problem of the adrenal glands, usually due to autoimmune issues, but you can have other issues that the adrenal glands with Addison's disease or other forms of adrenal insufficiency don't function properly in a life-threatening manner, right? Adrenal fatigue leads to all sorts of problems with fatigue, metabolic issues, weight issues, that type of thing. But usually it's not life-threatening, right? But with adrenal insufficiency, your blood pressure drops. You can die from that, right, if it's not treated appropriately. But if we begin to talk about adrenal fatigue in the context of HPA axis dysregulation, meaning that our adrenal glands aren't responding appropriately, right? And we have good allopathic studies that show that depression, PTSD, nutritional deficiencies, sleep disruption, issues, other issues will actually lead to dysregulated cortisol production. And then when we do with more naturopathic testing, we see that, okay, we're not producing cortisol in a normal manner. And then we begin, if it's very flat, we call that adrenal fatigue. But that's really just like low levels of cortisol, right, that don't respond appropriately, which are HPA axis dysregulation. So a very long-winded way to say, I think we're talking about the same thing. We're just talking two different languages with two different names.
Yeah, I agreed. And I think a lot of people maybe need to have the understanding that the reason why it's related to stress is because cortisol is your fight or flight hormone. So when you are under stress, your body gives you extra cortisol to help you manage that stress. So the idea when you're under constant stress, and tell me if I'm wrong here, but this is my understanding of how one can become adrenally fatigued, is their body is constantly having to give them excess cortisol, more cortisol than they need, to the point where you're almost burning out your body's ability to give you this extra cortisol, or to give you the appropriate amounts of cortisol, which then in turn can dysregulate the HPA axis and everything, as you were just speaking to.
Correct. I don't think I think the term burnout is we don't exhaust the adrenals, but we probably the pathways that lead to cortisol production, right? The endocrine pathways are tremendously complicated, right? You can put them up on a wall and on all the arrows and drawing, or, it's like Beautiful Mind, right? Arrows go everywhere, right? So we're probably disrupting the pathways that lead to cortisol production, right? Or appropriate cortisol production, so that we don't get that circadian rhythm or with that diurnal variation of cortisol production. So then our cortisol becomes, first it's chronically high, then it may become inappropriately secreted to not secreted at all. I think it probably, again, opinion, and this is where we need to start talking the same language. And this is where we need to really look at these issues. It's probably disruption of pathways that lead to cortisol production, just get overwhelmed or get shunted into a different direction. So, and I always like to say, we live these highly stressful lives, like we're connected all the time, right? Our testing was developed in the 1950s, right? The way we look at things was designed for a lifestyle that we no longer lead anymore. So we also need to adapt how we measure things. What's normal? What's not normal? What's pathologic? What's not pathologic? We need to look at these things a little differently as our lifestyles evolve. Our bodies haven't caught up necessarily, but how we measure how our bodies are responding actually needs to evolve. So a cortisol level from, that was developed in 1950 is not reflective of the stresses that we are all under today.
I have a question about that. So when you see, when you do a blood test or a hormone test and they check your cortisol levels and there's a range, is that range from the 1950s, or has that range evolved? Because I know it's also different based on the doctor you're going to. So I have a traditional doctor, and then I a trains MD doctor, and I also have an integrated doctor, and their opinions are different on what the ideal range is supposed to be. So in my integrated doctor wants certain levels to be, lower, whether it's cortisol or other things, whereas my regular doctor is no, it's fine, it's in the range. So where do those ranges come from?
Yeah, I think that in our world of allopathic medicine, right, we wait for a lot of studies to come through, right? And I think a lot of more integrated medicine is done from how's your body working, right? How it's in a one study, right? So it's like, how is your body function the best, right? Where have you been in the past? Where are you going? I mean, we have what's normal and what's not normal to look at disease states, right? We're really looking at what is a major disease state, which is in allopathic medicine versus where's your body function the best, basically. So those more integrative approaches are by nature going to be more highly personalized to where your body works the best. And also the nuances in between, what is normal and what is not normal. And cortisol is actually needs to be measured, usually over 4 time points of the day to see exactly where you are, right? Because, cortisol is high in the morning, it's lower in the evening, but you could have an aberrant spike of cortisol in the afternoon and still be in a normal range, maybe. So, so again, it's that more nuanced view that an integrative practitioner is going to have.
It's an interesting point that you're looking at the two different doctors it's such a simple way to put it. The integrative is looking at like how to optimize you, nuance, how to make you feel great. And then the Western medicine or the allopathic doctor is looking for a diseased state. Is it really like that simple between the two?
I think that allopathic medicine is evolving, right? I think that in the past, allopathic medicine has been, put a band-aid, not band-aids, right? Put out the fire, right? We haven't really focused on prevention, and prevention is optimization of your health, right? And there's a focus now. I mean, that focus is now moving and changing, and there's groups of doctors now who are focusing on that. There are more, MDs who are functional medicine physicians are looking at that. So I think it's an evolution of medicine, right? In the past, we were just struggling, like we have a cancer, we need to treat this cancer. We have hypertension, we need to treat this hypertension. So in the past, I think, we were doing kind of the best we could do at the time, right? Because we needed to really put out these fires. And now that we're learning, how we're putting out fires, like, cancer treatments have evolved so greatly to the point where, many cancers that when I first started in oncology were completely not curable are totally curable now, right? So allopathic medicine has served us really, really, really well in putting out these fires and treating illness. But now we have to evolve. We have to look, okay, how do we prevent these things from occurring, right? And that's just a natural evolution of any area of science and medicine. We have to change with the way we look at things, with how we're doing with things, basically.
Speaking of that, let's get into a little bit more of women's health midlife. There are a few we hear a lot about hormone therapy, estrogen, progesterone. What we don't hear a lot about, but are very important factors, and I saw this on your blog, is talking about DHEA and androgens and their importance. So talk to us a little bit about that.
So androgens are hugely important for women, right? And they've been very poorly studied. They're studied a little bit better in the UK and in Australia than in the United States. And indeed, there is an investigator in Australia who has a very big interest in androgens in women, and they have the only on national formulary approved testosterone supplement for women in Australia, nowhere else in the world. So androgens, as estrogen fluctuates, right? So as from 35 on, like our hormonal changes start at 35, basically, we know our fertility falls off between 35 and 40, but we don't know so much about it hormonally otherwise because we haven't really studied it so much. There's been some large studies, a couple of large studies that have shown the trajectory of hormones over time, but the changes start what we call the late reproductive years, right? So estrogen starts to fluctuate. It goes up and down. It becomes a little more erratic. Progesterone uniformly kind of goes down. And with progesterone going down, so does testosterone and DHEA. So before we go through menopause, half of testosterone comes from the ovaries, right? Half from the ovaries, half from the adrenal glands. And then as the ovaries don't function as well, then all of it comes from the adrenal glands where our testosterone levels naturally decline. So I'm just going to start with testosterone first because we know a little bit more about testosterone than we do about DHEA, but testosterone is important for women for mood, maybe cognitive function. We know it's important for libido for some women. Body mass, actually maintenance of lean body mass, metabolism is better with more testosterone. So testosterone's not been well studied in this country, has been better studied though in Australia. And we know that testosterone supplementation can help with mood, or what I call that joie de vivre, or self-confidence, right? Because as testosterone starts to fall down, so does self-confidence for many women. DHEA is the same thing. DHEA is important in maybe bone mass, maybe cognitive function, maybe mood. Libido has been shown to be important. And but there's not a lot of studies. I mean, it's like, there's not a lot. I just wrote a review for this, and there's just not a lot written about it. Mainly, though, it comes from the UK and Australia. There's a large move now in our country now to in the popular press and amongst people who are, I guess, speaking directly to a lay audience, right, of testosterone supplementation for women. We've used it for a long time in our practice just because I recognized early on that it was an important hormone for women. Molecule per molecule, we have more testosterone in our bodies than we have estrogen, actually. And I kind of noticed early on that, if I was helping women with if they had low testosterone levels, I gave them a little testosterone, which has always been occurring in the integrative world, but not so much in the allopathic world, that people felt a little bit better, right? And so now there's a big movement through social media. There's actually a slide that I have that I always put up that shows that a big kind of menopause advocate in the UK started talking about testosterone, and the request for prescriptions, and the prescriptions went up, right? But we need to study it. We need to look at it. It is being looked at in Australia a little bit more, and then in the United States. But interestingly, the studies that are ongoing with testosterone are with cardiac function, actually looking at cardiac function and the improvement in cardiac function with androgens. So, we talk about mood and quality of life with menopause and androgens and estrogen, but there's like real medical impact with these hormones, with cardio protection, bone health protection, metabolic protection, brain protection, actually. So so investigators are also looking at this with testosterone. So it needs to be more well studied, but there are a subset of women who actually do so much better on testosterone replacement, who are on hormone replacement with estrogen and progesterone, who are just missing that extra testosterone, and they get that extra kick from testosterone, actually. And we need to look at it. There's great safety data for it. There's no data that shows that it increases the risk of breast cancer, blood clotting, this type of thing. We'll get more information with testosterone in women as we look at our transgender groups also, right? Because remember, we're giving women now, we're giving XX testosterone for gender affirmation or gender confirmation concerns. So we'll get more information, but it appears to be very safe, actually. But a lot of practitioners don't have experience prescribing it. So don't prescribe it from lack of experience, basically. So we need more question of our practitioners also.
I have a question about the testosterone, just for our listeners who, aren't doing hormone therapy or don't know the intricacies of it. Like, when you administer it, is it a cream, a pill, the pellets? Like, I do the cream, for example, but like, is there other way? Like, what is your preferred method, or does it depend on the person?
I always start with a cream, right? And that is what is approved anywhere between 2 and 5 milligrams. That's what the Australians use. That's what's on formulary for them, Androfem. And the cream, I think, is the safest. It gives you, I think, is the safest way to start, right? Because also we want to make sure that you don't have adverse impacts from it. Some people get headaches from it, maybe a little ragey from it, that type of not feel so great. So I always start with a cream. There are people who don't absorb creams well, actually. So then in that situation, we'll move to like a little troche that goes underneath the tongue, right? And even with that, some people don't get absorption. You can move to a vaginal suppository or vulvar cream in that situation. Some people prefer a vulvar cream. You get transmucosal absorptions. You can also do a vaginal suppository. And then you can move, if for some reason you still have concerns with absorption, which some people still oddly do have, you can move into an IM injection, actually. Some people prefer that, but that's usually done on a monthly basis, so not so convenient. And then pellets. Pellets get very high levels, and I think for some, I mean, I'm not a huge fan of pellets because the how high the level is. It's not a physiologic level for women. I try to dose to a physiologic level, and that's what I think most of us try to do, right? But these very high levels, people, the pellets get these very high levels. But I do have people who will do pellets occasionally if they've done them in the past and they've done very well on them, and they don't get absorption any other way. But you just have to be very extremely careful and conservative. They are not FDA approved at all. At least for the creams and topicals, right? They're on formulary in Australia. There are gels for men that we use. Some people even use the gel packets for men and try to measure them out. The problem with that is the measurement is not so accurate, and also if they have any alcohol in them, the alcohol will evaporate, and then the dosing gets off a little bit as the gel pack is open. So not the best way to do it. So I usually do a compounded cream that works for the majority of my patients. If it doesn't work, then we use a Troche, and that's usually where we are, or a topical vulvar cream.
Yeah, that's helpful. Yeah, I feel like the pellets you used to hear about, and it's kind of like I haven't really heard about them lately, but I also heard that even with those, you can't take them out, or if you have side effects, it's you're kind of not able to adjust. So that's scary. I mean, the cream has worked really well for me, but it seems like you don't hear as much about the pellets as I feel like you used to. Or
I think as testosterone becomes more mainstream and more practitioners are using it, then you hear less about the pellets, because most more mainstream practitioners are not using pellets, basically. So the cream.
And then with the cream, this is a super tactical question, but I am always curious. Where do you recommend people put it? Because I do it here, right? On my whatever, the forearm. But I'm always is it gonna, if I just do it here every day, is it gonna wear out? Do you have to switch it up? What's your reco?
So my rec on that, and I always want to do a little video for this, is I inner arm, right? And rub your two arms together, right? Because then you don't get it on your hands too. Because if you're getting it on your hands, it can go to your kids, your dogs, whatever, right? But also it's not absorbed there. So you just end up washing it away. So what dose did you get here, right? On your, where you put it, what dose did you get? So I always put inner arm, rub my two inner arms together. And, look, you'll have some hair growth there eventually. And, but, I take a razor and shave that little part of my arm, Some people like the inner thigh actually for absorption reasons, so that if they get a inner thigh soft skin, right? So that, that you don't, so that if you get hair growth that's on your inner thigh. But I think inner arm is just fine. I'm super sensitive to this stuff. The compounding pharmacists, they'll tell you, oh, you have to rotate it, whatever. I'm super sensitive. If I don't have my hormones right, you don't want to be around me. I get depressed. I'm actually a train wreck without them. And so I know when they're absorbed and when they're not absorbed, and it's always absorbed when I put it on my inner arm. So I think so. My N of 1 trial is that I'm getting good levels with that, and I measure them.
That's great to know. And what about estrogen? Same thing?
Same thing, actually. So same thing. Estrogen is transdermal. It's either a patch, it can be a gel. If you're using a compounded form, it's a cream, but you can get bioidenticals in an FDA-approved form in a patch or a gel now. We don't usually recommend an oral preparation for estrogen because it has a higher risk of clotting associated with it.
And you can do I use a progesterone cream. So can I do all of my creams on my forearm?
That's what I do. And that's what I recommend to my patients. Okay. And they get good levels.
You could just mix them all together in one.
Okay. Great. Good to know.
I never knew that. Yeah. I was always doing separately. I would do my testosterone and then I'd do my estrogen later in the day, because I thought you couldn't mix them. But
as long as your volume is such that, you can get all the volume on there, right? Usually what we do is we do testosterone in a super small volume, estrogen in a super small volume, and then progesterone is a larger molecule, so it has to go in a larger volume. And so that's where you usually get the volume. But if you can do things in a super small volume, or just a small volume, you can get them all on.
All right. That makes it easier. Good to know.
Yeah. I want to touch on DHA super fast, just because I find it to be a very interesting one. I mean, considering my adrenals don't function properly, I have to replace it, but not everyone does. It is readily available. You can get DHA over the counter. So I just think, if you're not feeling great and you're in midlife, it's worth checking your levels and talking to your doctor about it, because that is one that is super easy to get your hands on. And they have everything from 5 milligrams up and up. But I know I feel really lousy when my DHEA levels are low. I think for me, it personally affects my metabolism, it affects my mental clarity, it affects my mood. So I just feel like for anyone that may be a little daunted by HRT and the access to it and everything, it could be a good place to start. What are your thoughts?
I think it's a great place to start, actually. I think, interestingly, there's fewer articles or studies concerning DHEA in women than testosterone. There's like virtually none. But what we do know from DHEA is we do know that it does help with mood, it does help with libido, it does help with bone health, it does help with metabolism. If you remember the study, and it maybe even helps with cognitive health. There's people that are beginning to address that in some studies. And you're correct. I think the important thing with DHEA is just not go too high on it, right, as you're going up, because you can get dosing anywhere between 5 milligrams and even 50 milligrams over the counter. And I think start low, see how you do, because some people who have overshoot their DHEA actually have anxiety. It can be anxiety provoking if you overshoot it. So, but again, I think it's a great place to start. Remember, DHEA is also a hormone for estrogen and testosterone. So it can, if you're kind of starting to transition into menopause, that late reproductive years, early perimenopausal years, right? It may be enough to kind of just help you along a little bit before you go full on with, other hormone support.
Yeah, sure. Okay.
Yeah. Where does the thyroid fit into all of the hormones? And I know that's sometimes talked about when you're talking about hormone therapy, but where does that all fit?
I think it's just important to always make sure that your thyroid is optimized, right? In terms of, thyroid dysfunction, certainly as we age, we have a tendency to become a little bit more hypothyroid or the thyroid not working as well. In terms of just menopause impacting the thyroid or midlife impacting the thyroid, I think it's just important. There's many women who have thyroid dysfunction, Hashimoto's, right? I think it's just important to always make sure that that is totally optimized, because that may be forgotten about or overlooked. I mean, it shouldn't be, and an integrated person is not going to overlook it, but it is an important component of that hormone balance and should always be optimized. It's one that's on our panel that we always test.
Yeah. And that's one that is an interesting one for me recently, because I've been looking at my thyroid and Katie's been looking at all my numbers because she's so good at this. And again, the ranges are different, right? My integrated doctor is no, your numbers should be much lower than they are. And my other doctor is they're fine. You could do something, you don't have to. And it's just interesting, right? Just playing around with the numbers and different things you could do to just see how you feel if you're taking something or not taking something. So I think it's an important one to, especially for women starting to go through menopause or midlife, to look at.
I think always with any of this, right, whether it's thyroid, DHEA, testosterone, estrogen, it's looking at the levels, but it's also saying, how are you feeling, right? How do you feel? And that's your N of one study, right? Because what works for you might not work for somebody else. But I think this is where we fall down in allopathic medicine. Oh no, it's normal. It's in the normal range. But for you, that might not be normal, right? So that's where that, how do you feel? That's the first question I ask anybody that I'm caring for. It's how do you feel?
And I think it's an interesting question because Katie's very in tune with how she feels on a daily basis by the minute. And for me, it's sometimes I'm yeah, I feel fine. I'm tired, but whatever. I think there are so many women that are walking around tired or not feeling right, but they don't feel bad. They're just kind of yeah, I feel fine. And they don't know sort of what good looks like, that if they did hormone therapy or if they did help their thyroid, how much better they would feel. So Katie's always saying to me oh, I don't know if I want to take this. She's but just take it, because you don't know, you might feel better and not even realize how bad you are feeling, which I think is so interesting. So once I started down this journey of HRT and all this stuff, I was oh, I do feel so much better, but you don't realize it. I just think a lot of people are walking around oh, I guess I just feel this way. And it's not terrible.
Right.
I can deal with it.
I'm getting older. This is how I'm supposed to feel. Yeah. I think that's true.
No, I think for women's health, especially too, we normalize not feeling so well, right? I mean, we have a period. We don't feel well before the period. We don't feel well during our period. We normalize not feeling great, right? So we can't normalize that anymore. We have to it's so important to be in tune with. And so maybe the question is, how do you feel? Could you feel better?
Right.
And
how do you optimize it?
Yeah. So maybe I'm asking, I think I'm asking the wrong question. Could you feel better? I think I'm going to change that. Thank you.
Oh, you're welcome.
Well, speaking of feeling better, what are your top supplements that you suggest for midlife? Because these are easy things that our listener could do. They can run to Walgreens or CVS instantly and integrate something into their regimen.
I think, it's important always to make sure that your vitamin D and B12 and folate levels are adequate, right? So I always say supplement where you're deficient, right? So just get some basic vitamin levels checked, right? And supplement or where you feel like you may be deficient. Multivitamin, I think, is really important, actually, from the cognitive standpoint, right? Because we have data now that shows that a multivitamin will be helpful to you in terms of maintenance of cognitive function later in life. There's a lot of studies that show that doesn't help prevent cancer or these other things, but does help with cognitive function. Fish oil or an omega-3, super important, anti-inflammatory. Magnesium is great for energy production, actually, and kind of mood and sleep. So that's one that I usually recommend. And when I target supplement recommendations, right, I'm targeting where are you deficient, and then what are the issues of aging? The issues of aging and women's health are, and for everybody, basically, are inflammation and mitochondrial support. So mitochondria are the powerhouses of our cells, right? So as we age, inflammation increases, and we want to knock that down. And also we want to keep our mitochondria super healthy. So again, so for mitochondrial support, that would be magnesium would be helpful. The CoQ10 is helpful for mitochondrial support. A fish oil is good as an anti-inflammatory. And so those are kind of and then creatine actually is another one that I begin to talk about, because we haven't really talked about how the body really changes as we transition, our hormone levels kind of change. But we tend to increase, as our estrogen levels start to fluctuate and go down, we tend to increase our visceral fat mass, which is inflammatory. So creatine is good for maintenance of lean body mass, which helps us to maintain a better basal metabolic rate, right? Because fat burn, it helps with our metabolism, because muscle will burn more calories, right, than visceral fat does. So keeping our metabolism in check and also keeping us strong so that we don't get frail. And creatine is also helpful from the mitochondrial standpoint also.
Do you have certain, I'm sure people ask you this and it's a hard question to answer, but do you have certain brands that you prefer? Because I think it's very hard for the average person to figure out, because there's like a bazillion brands. If you go into the drugstore, there's a million online brands, and it's like really hard. Even if they say organic, like you just don't know what you're putting in your body, and it's scary, right?
Right. Yeah, I mean, I do that when I go to the drugstore on Saturday afternoon. I make my husband go to the drugstore so I can buy my supplements and stuff like that. And it is hard because you don't know who's really making this stuff. So I usually recommend Thorne and Pure Encapsulations are the two that I recommend.
Yeah.
And you may have to order those online. I always recommend ordering directly from either a good formulary, like FullScript is a good one. And I don't have any financial relationships with any people. I'm truly giving you my recommendations that are just based on what I do. So FullScript, or then directly to the manufacturer. I don't usually recommend, third-party online types of supplement groups unless they're well vetted and well known. And FullScript is one. That's one that most of us use, actually, or many of us use.
That's great to know. Yeah, because I mean, people are buying supplements off Amazon, and it scares me because you're like, even if you know the brand, you're like, you don't know who. You just
and if you look at these studies, if they're not third party verified, they may have lead in the making process, or you may not have an active ingredient, or you may have too much. So again, I try to always recommend what is third party verified and what has a really nice, good reputation within professional circles and manufacturing circles, and then does their own third party verification. And then I usually do my own research also, just to make sure that everything is as it should be in the company that's making the supplement and that type of thing. It's tricky. It's really hard.
Yeah.
We've heard time and time again, Thorne and Pure Encapsulations are constantly recommended. And just like over the years, doing my own research, they've always come out on top. So that's a brand that both of those brands I use a lot of. Okay, so let's get into some brain health basics. We should touch really quickly. And throughout the podcast, you have mentioned the benefits, high level benefits of HRT, like cardiac health and bone health and, retaining muscle mass. What about brain health? Let's touch on that.
Super important. And it needs to be spoken about much more, actually. So women account for 2/3 of individuals with dementia and have a twofold elevated risk of dementia when compared to men. And when women transition through menopause and when estrogen levels start to deteriorate, you see kind of all the hallmarks of the physiologic changes with dementia. So metabolism in the brain changes, the glucose metabolism in the brain changes, blood flow to the brain changes, the brain size actually changes, and amyloid is deposited, right? So we know that declining levels of estrogen actually begin to change the structure and function of the brain, basically. And also Dr. Mosconi and her work, and there's a lot of work that's been done in animal work and human work, and just hasn't had any kind of play at all until very recently. But Dr. Mosconi and her work actually showed that as we go through perimenopause, our estrogen receptors go up in our brain. So the brain is actually hungry for estrogen. So we also have data. If you look at a large meta-analysis of all the data that we have, if you start estrogen within between 1 and 3 years of menopause, the earlier the better, right? Then your risk of dementia goes down, actually. So, the Women's Health Initiative study was a really lousy study that we all talk about, right? And in that study, that it said, estrogen is associated with an elevated risk of dementia. But we know that a lot of these women were far out of menopause by the time they started estrogen. So what we've learned from the Women's Health Initiative study and looking and reanalyzing a number of these studies is that there's an window of opportunity for hormone replacement therapy to decrease one's risk of developing dementia. That is earlier in the menopause transition, right? And then if you initiate estrogen later in life, you actually may be doing some harm. So once estrogen is given far out after menopause, it may increase the risk of dementia. And there's a number of analyses that have shown this, that there's a curve that estrogen initiated early on, lower risk of dementia, estrogen initiated later, higher risk of dementia. So it's a curve that goes down and then goes up, right? So you want to start hormone support earlier in that transition. We know that women start with brain fog, though, far before that. One of the symptoms of late reproductive years and early perimenopausal transition is actually brain fog, right? So one of the questions that I always have is should we start earlier, right? So if a woman has brain fog, that's always a very concerning symptom to me. And I'm like, okay, I need to figure out, is this progesterone? Is it estrogen? Like what is she deficient in right now that's kind of leading to this brain foggy kind of feeling? So we really need to pay attention to women's brain health. This is one of the areas of medicine that is super gender specific, right? We know there's gender specific aspects of cardiac health, metabolic health, and also brain health, right? The brain does respond to estrogen. So there's a window. What we know now, where we are right now, is that there's a window of opportunity for hormone support to decrease dementia risk, basically. And then the question I have is for women who can't have estrogen for whatever reason. Maybe they have breast cancer and estrogen dependent malignancy. What can they do also? And that's healthy lifestyle, right? So one question also that we need to ask is, we look at these studies, but we never really adjust for a lifestyle, right? So if you have an anti-inflammatory nutrition, good stress management, super important for brain health, good exercise, right? Exercise is crazy great for your brain. This is why I exercise every morning. Not necessarily be fit, but to keep my brain fit, right? Because myokines, which are when we start to pump skeletal muscle, right? We release myokines, which are these little molecules that travel through the blood. And there's ricin and BDNF, which are released with exercise, which actually help the brain. And actually BDNF actually grows the brain, right? And helps with plasticity of neurons and that type of thing. So exercise, super important. And then also, maintaining community engagement, right? And just having that sense of purpose, and super important, and sense of purpose and being connected with people. And then I always say to people too, know your family history, right? Because, if you have a family history of dementia, if you have an ApoE4 variant allele, right, you're going to have a higher risk of dementia. So you might want to double down on these a little bit more. So it's hormone support, but it's hormone support with lifestyle, or lifestyle without hormone support. But lifestyle for brain health is that key foundation.
I always feel so much more focused and sharp and mentally clear after I've exercised, and you've just explained why. So thank you.
There's a scientific reason why.
Right, exactly.
So, we learned this stuff when we were like, I'm like really old. So I'm a million years older than you guys, but in first grade, those little posters is like, you are what you eat, and you exercise and go to gym class. We just didn't know the reason why, but they're true. I actually want to get one of those posters and put it in my office, actually.
Like the basics, right?
The basics. And we just know the science of the basics now.
Yeah.
We could do a whole episode on brain health, and I think we need to. Maybe we can
I know we do. We haven't really covered that topic in depth.
Yeah, it's
really an emerging field because, we're not destined to have bad brain health as we age. We can change that.
Before we let you go, I feel like we would be remiss if we didn't ask you. So could you just maybe hit a couple high points of what our listeners maybe should look out for if they were dealing with potential gynecological cancers? Just any symptoms that I feel like it would be a shame for us to not mention that today.
I think I always tell my patients that, anything that you think is unusual, report it to your physician and make sure you have an answer to that unusual symptom. And that may be, and I think listening to your body is really, really important. And maybe this is what we need to talk about more with our patients too, is like, don't normalize pain, right? Because again, we go through these cycles of pain every month. But pelvic pain that's new and unusual or different for you, a bleeding pattern that's new and unusual, different for you, a discharge that's new and unusual, definitely report to your physician. Make sure you get answers. Don't just say, oh, it's okay. Just find out, but get the answer. Like, why is it okay? Like, what is causing it? I think, abnormal bleeding is a big one, but also fatigue is another one that we don't speak about so much, right? So ovarian cancer, which is the most lethal of the gynecologic malignancies, doesn't come out and say, I'm here, but it whispers at least a year before it usually presents. That may be new urinary frequency and maybe some pelvic cramping or bloating, anything that lasts more than a couple of weeks and doesn't go away, get some answers. And I think that the most important thing too to recommend is make sure you get all the screening tests, right? We go back and forth. Do you need a mammogram? Do you need at 40, get a mammogram at 40 with a breast ultrasound, right? Or get some type of breast imaging, right? And every year, there's some people that have come and said, okay, now we're not going to talk about every other year between 40 and 50, but every year at 40, get to know your breast, know how to do a good breast self-exam, know your family history, right? Know your breast density, right? These are all things that may put you into a different screening modality. Knowing your family history is really important. I think for, that's the GYN cancers. I always put breast with GYN cancers, right? And then also make sure that you get all the right screening. Make sure that you get to your doctor every year. Talk to them about a yearly pap smear. Talk to them, do I need a yearly pap smear? Why? The recommendations are every 3 to 5 years at some point, but there's some people that may have had HPV that didn't know they had HPV. I actually am one of these people, right, who had HPV, didn't know it because it just didn't catch on one of my pap smears, basically. So speak to your physician about what screening test you need. Get that colonoscopy. I mean, it's not a GYN cancer, but it's a colon cancer is on the rise. Get that screening colonoscopy at the age of 45, or get some type of screening test. Maybe it's a Cologuard, get something at the age of 45. And also know your family history, because you'll want to do that a little bit younger if you have a family history of colon cancer, uterine cancer, ovarian or breast cancer. So I think, kind of what I always counsel people, let me know if you don't feel right. Let me know if you have fatigue. Let me know if you have pain, bloating, urinary frequency, change in your bowel habits, something doesn't feel right to you. Report it to your physician, whether it's your gynecologist, your family doctor, your internist. And make sure you have an answer to it. Make sure that if it's a symptom that's continuing, you have an answer to it, that it's okay, but what is it, And I think those are the most important recommendations I could give.
That's excellent advice.
Thank you.
Yeah. All right. Well, let's dive into our wrap session. Amy, do you want to?
Yeah, I can start this section as a quick fire, really fun one. But before we do that, just in terms of where people can find you, I know you have a practice in New York. Can you just talk about how people could get in touch with you?
So right now we're working on a book, and I'm actually chair of women's health at Atria currently, and I can be found on Instagram. We have a book coming out, and those are kind of the best places to find me, are online right now. And in the future, we'll have a little bit of a different and bigger presence.
Nice.
Awesome. And do you see patients in your New York office as well?
I'm seeing patients right now on a limited limited basis right now. I'm focusing on developing and helping to develop a women's health program right now, and
Amazing.
working with technology and how we get what we've been talking about to everybody. So it's not just in a practice, and it can be in a bigger kind of fashion, and women can get the information and content that they need.
That's fantastic. Well, thank you for
Awesome.
all
Okay.
of that. Yeah.
Getting into our wrap session. What is your favorite wellness or beauty hack?
Exercise. It's crazy. If you look at data with skin, and just like for beauty, let's just talk about skin, it increases collagen production, aerobic and strength training. So it's my biggest hack, beauty and otherwise, is exercise.
Fantastic. Okay. I love that. The next one is our 5-minute flow. You just got out of the shower and Uber has pinged you. They are 5 minutes away. What are you going to do quickly to pull yourself together? What are your holy grails to get into that Uber on time?
By the way, everyone, she is gorgeous and has like flawless skin.
Yes.
So I'm very interested in this one.
To get together. Do you know what? I think the most important thing is that it's just that day is just going to be one of those days that you're going to have to go with the flow, right? We, throw on scrub. I mean, I'm lucky because I can throw on scrubs, right? I can throw on figs, right? So I can throw on figs and a white coat, put my hair back, and, I can't pretend like I'm going to the OR anymore. I used to be able to put my hat on and that would be it. But, I think my holy grail for that would be just to get over yourself that day, and you're just it's not all going to be together that day, and do your very best to get going.
Okay. And how do you maintain your daily nirvana?
Gratefulness. I think always gratitude. Total gratitude. I'm happy to be here. I want to be here for the next 100 years to see what this world brings us.
Amen to that. All right. Well, thank you, Dr. Poyner. Thank you so much for being here. It was such a pleasure to speak with you. I feel like you gave us so much fantastic information. So we really appreciate your time.
This has been really nice. Thank you it's been an honor and a true pleasure. And thank you so much for, like I said, allowing me to speak my very favorite topics.
Thanks for listening to Nirvana Sisters. For more information on this episode, check out the show notes, please subscribe, and leave us a review. Also, find us on Instagram at Nirvana Sisters. If you loved what you just listened to or know someone that would, please share it and tag us. Tune in next week for a fresh new episode of Nirvana Sisters. We'll continue to watch out for all things wellness so you don't have to. Bye.